toxin. But essentially, how it worked in women was it increased levels of infertility potential up to 92%, which is pretty substantial. And the conclusion of the findings was the findings may serve as an alarm to the harmful effects of these drugs on female fertility and be taken into consideration in females planning to have a child. What are NSAIDs? NSAIDs are a non-steroidal anti-inflammatory drug. Why is this important to talk about? Well, there's 30 million daily users of NSAIDs worldwide, making it one of the top over-the-counter drugs used for pain, inflammation, and more likely than not, like a daily multivitamin. All that to say, it's not to go without any sort of side effect, and the information on them is pretty interesting to say the least. So, today I want to talk about some research I came across specifically to NSAIDs and how it affected men and their testosterone levels and infertility, how it affected women's infertility, some cases up to 92%. And then some other side effects like gastrointestinal bleeding, ulcers, and such, acute kidney failure. So, in any sense, not something to just have in your daily routine, thinking that it isn't causing some sort of effect in the body, and information is important to know. So, let's start with kind of what it does. So essentially, NSAIDs block cyclooxygenase, which is an enzyme, and they're typically referred to as COX-1 and COX-2. These enzymes do different things like create prostaglandins and stomach mucosa lining to protect the stomach from stomach acid. They do things like allow for inflammation responses to happen. So if you completely diminish them, it's not necessarily beneficial. So we have to consider what inflammation is in the body. So it starts off with the injury or trigger for why your body responds to inflammation. And it first releases these cytokines. They're essentially protein messengers that blast out systemically to say, hey, we need to start this process to heal a infection, fever, or a injury. All right. So then next, the cytokines ignite the COX enzymes that are in the cells. So enzymes are just chemical reactions, the chemical catalysts in the body that otherwise would take millions of years to happen. And these enzymes get recruited by different messengers in the body. All right, so then these cytokines are activated, and then they flip on an alarm switch, kind of directly talking to genes inside the cell, and these genes inside the cell ignite the existing COX enzyme. So then these COX enzymes grab arachidonic acid from cell membranes. Arachidonic acid is an acid that is derived from omega 6 fatty acids, which the body needs, but of note, doesn't need an excess because it goes into a litany of other issues that would cause further inflammation, potentially autoimmune diseases. So that's another video for another time, specifically on nutrition and why excess omega 6 fatty acids, specifically from vegetable oils or processed foods, is not wonderful. All right, so going back, you got the cytokines, they're the systemic thing, telling the COX enzymes in the cells to activate. That then grabs the arachidonic acid from the cell membrane, and that gets converted, that arachidonic acid gets converted into prostaglandins. Prostaglandins are another messenger. They're a lipid or a fat messenger in the body, and essentially sounds the alarm and says trouble in this area, right? So it recruits then the healing factors and other things that come with the response to injury. And macrophages would be an important one, which are white blood cells. These respond and go through the process, which is called phagocytosis. So, phagocytosis is just these macrophages coming through, swarming in, and collecting up damaged cells and other potential debris that's in there so that it can go through the process of healing. So now that we understand that, the main role of an NSAID is essentially to inhibit these COX-1 and 2 enzymes. The interesting research I came across was how it affected men. specifically with hypogonadism. And I have the study pulled up here to talk about it. This was done in 2018, and it's interesting because the study showed that the effects on the androgens in men, specifically testosterone and their reproductive endocrine system, can be affected by NSAIDs. And the effects were after about 14 days, and the study went on for 6 weeks. So the dosage was about 1,200 milligrams of NSAID ibuprofen. And after about 14 days, they saw these effects. Now, you might think 1,200 milligrams is quite a bit, but according to the research, it shows that that is a pretty normal level. And you have to consider like that's taking it. Perhaps when you wake up, you're in pain. You are in pain by lunch, so you take another dose, and then in the evening, you take a dose to sleep, which isn't super uncommon if you have prolonged chronic pain. So, what the research significance says is concerns have been raised over declining male reproductive health in humans. A study addresses this issue by extending data showing anti-androgen effects, so anti-testosterone androgen, of the analgesics, and suggests that such compounds can be involved in adult male reproductive problems. Continuing on, talks about the Western world's concern with male reproductive disorders and the disruption of endocrinology. Um, the interesting concept here too that if you do some follow-on research, exposure during fetal life is associated with androgenic anti-androgenic effects in congenital malformations. So in utero in women, if you have a male fetus, the congenital malformations may lead to something like a micropenis or cryptochordism, which is essentially the testicles do not fall. And the reasoning being the direct correlation to the inhibition of DHT or dihydrotestosterone in the uh, developing baby. So that was another interesting one. Clinical condition named compensated hypogonadism is a condition prevalent among elderly men. Essentially, what we see is andropause. What they're kind of talking about is at a certain age, men see a decline in hormones, natural production, and it's the Leydig cells in the testicles that are getting desensitized or less productive when it comes to receiving LH to their then for produce testosterone in the testicles. They're essentially saying we saw compensated hypogonadism, similar to what we see in aging males, which is the Leydig cells in the testicles desensitizing to LH response from the pituitary. So compensating mean the body is increasing something because it's sensing a decrease in something. So this showed that they had an increase in blood serum levels of luteinizing hormone, which is LH that comes from the pituitary, that travels down to the testicles, then gets absorbed by the Leydig cells to produce testosterone. So they saw an increase in LH in serum and then a decrease in testosterone levels. So the body is trying to ramp up LH because it's sensing low levels of testosterone. Then it goes on to talk about the capabilities from Leydig cells and Sertoli cells. Sertoli cells have more to do with sperm production, morphology of sperm. If sperm isn't healthy, you could look at FSH and the Sertoli cells in the testicles to see what kind of issue there might be with the talking of the pituitary gland releasing follicle stimulating hormone into the Sertoli cells. So, the effects were ibuprofen alters the endocrine system via transcriptional repression of the human testes, thereby inducing compensated hypogonadism. And this was only after 14 days of the uh, of exposure to the ibuprofen. So if you scroll down, it says inhibition of testosterone levels was significant and dose dependent. So augmented over time, not something to overlook if nursing an injury and such for only after happening after 14 days. Uh, something definitely to be aware of. The next study talking about how it affected women and infertility. There was a different different types of NSAIDs used. You could find the study and pull up to see which ones, but Aleve was a common one, naproxen. But essentially, how it worked in women was it increased levels of infertility potential up to 92%, which is pretty substantial. And the conclusion of the findings was the findings may serve as an alarm to the harmful effects of these drugs on female fertility and be taken into consideration in females planning to have a child. So the effects on women fertility showed that it essentially disrupts the normal process of the egg traveling down into the uterus, and we'll dive into a little bit how that works. So estrogen rises, tells the pituitary to create follicle stimulating hormone, goes down to the ovaries, and in the ovaries you have follicles. Those follicles begin to grow, and then one of those follicles becomes the dominant follicle. And inside that is an oocyte or an egg. So that grows and grows and grows until the point where that bursts open, and then travels down the fallopian tubes into the uterus and then potentially gets fertilized by the sperm. So, what the results were showing of the research for women was prostaglandins play a direct role in that bursting. So if you diminish COX enzymes, therefore reducing the prostaglandins, those macrophages we talked about can't come down and eat through the cell walls of the follicles, releasing then the egg to go into the fallopian tubes and travel down. So the NSAIDs cause these dominant follicles to not burst, and they left functional cysts on the ovaries, but they found that those cysts went away by the next cycle. So interesting to say the least, up to a 90% decrease in fertility when you go through the process of inhibiting the COX enzymes and the prostaglandins and then not allowing for that dominant follicle to release the egg. Some other things to consider when it comes to NSAIDs is the prostaglandins that it inhibits directly correlates to recreation of the stomach mucosal lining. And when you inhibit these prostaglandins to do that process, you then reduce the health of stomach lining, potentially leading to ulcers and gastrointestinal bleeding, which if you take NSAIDs on the regular, that potential, could increase inhibiting that regeneration of the mucosal lining to essentially protect the stomach from itself, its own stomach acid. There was some other research that was interesting showing that it can lead to acute kidney failure, specifically in children that are dehydrated. So if you think a child has the common flu, cold, whatever, but they're sick, right? They're vomiting, they have diarrhea, they're extremely dehydrated. Well, the prostaglandins again help dilate vessels in the kidneys, and the kidneys are a filtering process and through different microscopic vessels. So if you inhibit those, it can tighten up the vessels in the kidneys, and then they can't filter correctly, leading to acute kidney failure. This is more prominent in people that were on certain blood medications and also can be common in alcoholics. So NSAIDs can lead to uh, kidney dysfunction long term. So that's also something to consider if daily usage is applied with these NSAIDs. So in the grand scheme of things, there's a lot of stuff that inflammation isn't always necessarily bad. And if you immediately sledgehammer the inflammation with an NSAID, that's not always productive for the injury itself either because it's not getting the necessary balance that it needs to help that inflammation. So, in closing, should we avoid NSAIDs completely? Kind of up to you and your provider to decide where and when you need them, but they're nonetheless interesting research has been done. And if trying to conceive, if recovering from injury, some of these things shouldn't be so quick to be used because anything we put in our bodies is not to be without some sort of effect, whether that's good or bad. And it's good to know this information. I wrote a blog about it, more in depth. If you want to check out the research, links are in there. Check out solutionstowellness.org. Like, subscribe, share the video if you know somebody that is potentially taking NSAIDs well, trying to conceive, this would be an interesting insight to share.